Hi, my name's Courtney. Today I will be giving an informational speech on the evolution of telehealth. I have my dad in the audience today, so the definition of telehealth is healing from a distance. The World Health Organization defines telehealth as the delivery of healthcare services where distance is a critical factor. All healthcare professionals use information and communication technologies to exchange information to diagnose, treat, and prevent disease and injuries. It's for research and evaluation and to continue the education of healthcare providers. It's all in the interest of advancing the health of individuals and their communities. So I began working in healthcare in 2019. I used to work at Grand Trail Medical Center in Myrtle. So there, it was a very busy hospital, so they would use a, kind of like a giant iPad, and they would use that to FaceTime, specialty doctors that we didn't have on call at the time if a patient needed them. So it looked like that, basically just a giant iPad. And then today we also use telesitters, which is just a giant camera, and we stick them in our patient's room that are fall risk. And there's a call center in, I think Baltimore City, and they sit there and they watch our patients, and if the patient gets up, they alarm us. It basically just saves us from having to lose a person to watch the patient and make sure they're being safe, because hospitals are so severely understaffed right now. McGraw-Hill Medical provided a basic outline to the evolution of medicine we know today. Doctors used to just make house calls. It was homeopathic medicine, and that was about it. Then the Pennsylvania Hospital was opened in 1751. It was the very first hospital in the United States. During the 1800s, there was a lot of significant advancement in medicine, like the stethoscope was invented, the theory of germs, which is basically just washing your hands, and the development of vaccines all occurred during that time. Treatments and equipment became more sophisticated, so you couldn't really practice at home anymore. You had to do it in clinical settings. So by the 1950s, less than 10% of medical visits were house calls. Everything else was clinical. The first incident of telemedicine that was referred in medical literature was the idea of technology-assisted distance diagnosis. This was in reference to the 1948 transmission of radiologic images by telephone between Westchester and Philadelphia, PA. I have this picture in here. So it was basically like people just couldn't get over the idea that we would use radio to communicate with our doctor. And then that happened a couple years later, where they transferred images across radio lines. Then in the late 50s and the early 60s, a television link was established between the Nebraska Psychiatric Institute and the Norfolk State Hospital for psych consultation. So it was basically like a super simple FaceTime. Then NASA was super big in telemedicine, which makes sense. It's how they took care of their astronauts. So in the 70s, the space technology applied to rural Papago advanced healthcare was developed. The people of the rural Indian reservation were linked with physicians in bigger cities. They used microwave relays to transfer patient information back and forth, so that these people that were in a rural Indian reservation could get the healthcare that they needed. Then in the 80s, NASA made an offer to the USSR to provide humanitarian aid after a massive earthquake that disrupted Armenia. They provided consults with providers like from the University of Utah, University of Texas, and the project was called the Telemedicine Space Bridge to Armenia. It was important because it increased international cooperation. Then with internet came the founding of the American Telemedicine Association. This was in 1993. According to their website, they're a nonprofit organization focused on ensuring that everyone has access to safe, affordable, and appropriate care. The association holds an annual conference, and this year's conference was all about emphasizing the importance of expanding telehealth and planning for future emergencies, because luckily we were able to use telehealth during COVID. We were able to handle it. It lessened the burden on our hospitals, like being able to screen people online or just have them communicate with their doctor online instead of coming into the hospital and just making it worse for everyone who's working nonstop with all the COVID patients. Telehealth is super important to hospitals in rural areas. It helps the hospital minimize COVID exposure to their staff while attending to all of their patients. They have a couple programs to assist them. Two of them will link larger city hospitals to smaller rural hospitals that are having staff shortages. And the third one is helping recently discharged patients with hospital to home care. Getting adequate healthcare in rural areas is super difficult, like I said before with the one in Arizona. Prisons use telehealth. Prisons are usually in rural areas, so it's super expensive and super time consuming to get an inmate to the hospital. They also have to take guards with them, and then they have to staff more guards in the prison, to cover the ones that are leaving. The CDC conducted a study and found out 30 out of 45 states use telemedicine in their prisons. Provides continuity of care, especially for inmates that have chronic conditions, so you don't have to take them to the hospital every time. COVID has managed to affect almost every person in the world. Accessing healthcare could be a major obstacle. You have to social distance, you're losing your jobs, you're quarantining, or you're scared of getting sick. The American Psychological Association has a paper about how COVID has affected mental health. It mentions how in the past 20 years, access to mental health care has increased so much. It's so much easier to get help for your brain, basically. Telehealth is beneficial to mental health because it minimizes your exposure to COVID, and it just makes it a lot easier, because I know I would be much more willing to make a phone call or make a FaceTime call than to actually go to a doctor's appointment. And it just helps our burned out providers. Telemedicine is not a cure-all. There's lots of people that don't understand how to use it. Old people, people who don't speak English well, and those without reliable access to technology. Also, different states have different laws governing telemedicine, and a lot of providers are worried about malpractice and licensing issues. Telehealth is healing from a distance, remote patient healing, and it's constantly evolving. We might not know what to expect, but we are adapting and overcoming. We are adjusting together. I saw this one, it was healthcare should be just as convenient as online banking. I thought that was good. And then thank you.